It is not just the infertility that is causing this. In fact, it has been studied that even the impact of treatment, of failed treatments, can increase the risk of increasing anxiety or depression amongst these couples. In fact, even in countries where the whole treatment is sponsored by state and hence the impact of financial burden is not borne by the couples, even in such countries it has been seen that there is a high dropout rate in the treatment after previous treatment failures, which means that even when couples do not have to bear the financial burden of treatment, it sometimes becomes very difficult to bear the psychological burden of failed treatments. Hence, not only is it important to make sure that we utilize methods to improve success rates, but we also make sure that there is a way to handle the impact of this burden of loss of wellness, mental wellness, which is affecting the couples. This is one factor, but an often less looked at factor is also, is there an impact of mental illness or psychological illness and distress on infertility? That means, can a psychological problem, depression, anxiety, lead to infertility? Now, much data is not available on this. However, a study on 58 women conducted in the United States showed that there was a twofold increase in infertility in women who were suffering from some major psychological problems. Now, whether this was only as a cause or an effect of the psychological distress, or was it related to other confounding factors which could be associated with a depressed state, such as increase in BMI, loss of libido, substance abuse, increased rate of alcohol, increased cigarette smoking? How these were influencing the infertility, the impact of these confounding factors could not really be seen, but in some or the other way, there is an impact of a psychological issue also on reproductive health. So there is a two-way, like we said, that we are a whole. What happens in one part sometimes does get conveyed to the other part. So whether it is the impact of infertility on mental well-being, or whether it is the impact of psychological problems in causing or being the cause of infertility, there is some relationship between mental health and infertility. Hence, it is extremely imperative that we address this issue today. With globalization, with increasing amount of social media usage, there is increasing mental health issue globally, and we are all aware of that. In fact, there are some who say that after the pandemic of COVID, the next pandemic is going to be that of mental health. And hence, each specialty in their own right should make some attempt to try and address the other issues and the other impacts of the primary problem and its effect on other issues such as mental health. This is one point that I wanted to bring out today, especially in this month, which is dedicated for mental health. And we at Xenith are trying to look at, if you go to our YouTube channel, you will see many videos on diet, on yoga, on even meditation practices, because we really feel that this has to be addressed as a whole, and it is very important for centers to address the impact that it causes even on the treatment success. And that's the last point that I want to get to. It's not only the impact or what infertility causes on mental health, what psychological issues and how they can cause infertility, how the burden of treatment can add to mental anguish, but it is also important to address that if we do not take care of the stress levels, if we do not take care of the anxiety, it could also result in decreased success rates after treatment. So it's it's like a hole, and it's like a vicious cycle. So we need to intervene at every point, and what better than to take care of our own mental health and address them as soon as possible.